For more than 10 years, it has been known that an exercise regimen is demonstrably beneficial in the medical treatment of both fecal and urinary incontinence. While it's probably not possible to increase internal anal sphincter tone by perineal strengthening exercises, muscle bulk and voluntary contractility of the external anal sphincter, puborectalis sling, and levators can be improved significantly by such a regimen. A simple exercise is to pretend to hold in a bowel movement and to count to 15. This can be performed 20 or more times a day while walking down the street, riding in a car, sitting in a chair, whenever the patient thinks of it. Bulging muscles, of course, should not be expected overnight, but given sufficient time, say several weeks to several months, the individual should note an improvement in voluntary control. However, this particular approach does indeed have limitations. A much more effective method is to utilize visual or audible reinforcement. It has been even demonstrated that some control of the autonomic nervous system may be obtained by means of so-called operant conditioning. Biofeedback training appears to be of specific value in the treatment of fecal incontinence in the elderly, as opposed to suboptimal results obtained by the simple sphincter exercises that I previously mentioned. We have found the use of the BioSearch anorectal biofeedback system particularly convenient. The device consists of a silicone anorectal probe and battery-charged monitor with color illumination to indicate the patient's response. This particular unit is an excellent tool for instructing patients on the correct method of performing perineal strengthening exercises, as well as the training of individuals troubled with obstructed defecation. Parenthetically, obstructed defecation, or anismus, is a condition in which there is paradoxical contraction of the sphincter muscles when an individual attempts to defecate. Obviously, this impedes the elimination process and is one of the causes of intractable constipation. Biofeedback is particularly helpful in these individuals in that visual reinforcement of the elimination process permits the patient to relax the sphincter mechanism in order to expel the balloon. It is not clear how long and how often biofeedback sessions are necessary, but most investigators seem to agree that booster treatments are suggested in those individuals who relapse, especially for those patients with obstructed defecation. Ideally, training should be performed several times a day, in the privacy of one's home for 10 or 15 minutes at a time. As with any training program, the success of biofeedback depends on the motivation of the individual. Constipation is a condition very common in this country today. In fact, it is the most common reason why patients solicit a physician's attention. It's a very complex matter, however, to discuss constipation in a vacuum. A lot has to do with diet, fiber, transit time. There's a small focus of individuals who specifically benefit from biofeedback in the treatment of incontinence. That is, the individuals who have so-called obstructed defecation. This condition is simply that of inappropriate contraction of the sphincter muscle. Now, when one sits down on the toilet and attempts to strain with a closed sphincter, no result occurs. What one has to do is to teach these individuals how to relax the sphincter so that they can pass a bowel movement without impeding. And it's for that unique group of individuals that biofeedback is of benefit. The muscles that create anal continence are a complex group controlled by the autonomic nervous system and also the voluntary nervous system. The internal sphincter, which is controlled by the autonomic nervous system, maintains the anal canal in a resting position. It increases the tone of the anal canal, but it really plays no important role in voluntary contractility nor the maintenance of continence for formed stool, shall we say. This role is played by a combination of the external sphincter and the levator ani muscle. This acts as a funnel muscle, that is, the levator ani does, and the external sphincter, which is the lower portion of the levator muscle and the most medial portion, tightens around the anal opening. This is the complex mechanism which controls the bowel movements and over which you have voluntary contractility. You can tighten the external sphincter, you can tighten the puborectalis, and this keeps you from eliminating in an inappropriate circumstance. Biofeedback is a method for utilizing one's senses to reinforce some other activity. Those senses could be visual, could be auditory, could even be an aroma through the nose that would tell you what to do or what not to do under a given circumstance. It is using one of these senses to create another action. Now, in the instance of biofeedback application for anal incontinence training, with the use of the device such as we are discussing today, one utilizes visual reinforcement, in this case a series of lights, to tell the individual just whether or not the exercises are being carried out in a proper way. The whole concept in the management of anal incontinence by biofeedback is to develop a training program, an exercise program, to build up the strength of the sphincter muscle. As mentioned, it isn't sufficient for many patients to simply instruct them concerning perineal exercises or so-called Kegel exercises for urinary incontinence or for anal incontinence. They need something else. They need some sort of reinforcement as to how those exercises need to be carried out. It's interesting that some patients, when you ask them to tighten the sphincter, they actually relax it and try to strain down. Without the biofeedback reinforcement, it is virtually impossible in some of these patients to get them to do the right thing, to carry out the exercises in a proper way. And so by means of biofeedback, one can get the patient to tighten up the sphincters in such a way as to improve their sphincter tone and contractility, and ultimately to improve bowel and urinary control. It's really difficult to say how often one individual should use this particular device, how often the exercise regimen should be carried out. Ideally, with a biofeedback regimen, perhaps once or twice a week in a doctor's office, the individual can constantly be getting reinforcement as to the appropriateness of the exercises that he or she is carrying out. In other words, are they doing it correctly? We're about to examine a patient who is a young woman who sustained obstetrical injury. The repair was affected, but she still has problems with bowel control. This is the BioSearch monitor. She has the balloon plug inserted into the rectum. This is a strip sheet which can give you the hard copy of the results of the study, should you wish to have that for the medical record. I'm going to ask the patient to tighten up as if she's holding in a bowel movement. Would you do that for us now? Just pretend you're holding in a bowel movement. Now tighten real hard. Now relax. Now you can see that initially she tried and nothing seemed to happen. Then on second effort, she moved the lights that they lit up for the first 5 or 6 lights. So we want to see what more she can accomplish than that. So I'm going to encourage her a lot more. Now would you squeeze as hard as you can? Tight, 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 tight. Really tight. Harder, 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 harder. Okay, relax now. Now you see she's come up to here. If we can get her to at least accomplish the maximum amount of exercise that she possibly can, then hopefully when she returns home she'll be able to carry out the exercise program in a more effective way than she would without the biofeedback response. Let's try again. Tighten as hard as you can now. See if you can get it all the way to the top. That's very good. Come on, maintain it now. Try to keep it up. Tight, 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 tight. Hold it, hold it, hold it, hold it, hold it. Okay, what I'd like to try to do is to get the patient to hold the sphincter muscle as tight as she can for about 15 or 20 seconds. Even more if at all possible. In addition to the visual reinforcement, one also has the auditory reinforcement. I think you can hear in the background the sound. And as she tightens up, the sound becomes more high-pitched. Maggie, would you do that, please? Tight, tight, tight. Another device is available which is used for individuals with obstructed defecation. It is essentially the reverse of the BioSearch instrument that you previously saw. In other words, when an individual relaxes, the lights become more evident. And when the patient contracts, the lights become less evident. What we're really trying to do, in effect, is to get the patient to push out the balloon and to relax the sphincter muscle. I'm going to ask the patient now to tighten up. Tighten as much as you can, and you can see that the lights are fading out. And now I'll ask you to relax and try to push the balloon out. Just try to push it out. And you can see that the lights are now becoming more evident. The concept here is to relax the sphincter so that the balloon can be released just as if when we're performing the act of defecation. You can't eliminate the balloon with a tight sphincter. Try it again. Now tighten up, and you can see that the lights disappear. And now relax, relax, and the lights become more evident. After the balloon has been inserted into the rectum, the rectal balloon is insufflated to approximately 30 milliliters. You can see that the balloon in the anal canal impacts on the sphincter mechanism, and it is this balloon which is monitored with the device to determine contractility of the sphincter muscle or relaxation of the sphincter muscle.